you, Manish. Thank you, Hindi team. Bye-bye. Now it is the time for the English session. Today is our 1388th day of continuous webinar. Welcome all the participants to today's webinar. As usual, we'll start the webinar with a silent prayer. Good evening and welcome once again. Thank you all the participants for joining with us. Thank you all the faculty for sharing your knowledge. And today's our guest is joining from Germany. Our Beatrix, Dr. Beatrix, you're welcome. She is a medical doctor for 35 years and she's practicing homeopathy for 31 years. And she's conducting a seminar and taking classes for 9 years. And she worked in only hospital practicing homeopathy in Germany. And she's now running her own clinic. And more than that, she is the coordinator of IFPH in Germany. She is IFPH coordinator of our Germany chapter. So I'm welcoming Dr. Beatrix to.
Thank you very much. Ich bin im Meeting, Katharina. Thank you very much. It's always a great pleasure to be with you. And thank you, Dr. Agnani, for the very, very nice welcome. In the meantime, I always feel at home when I'm with you.
Yeah.
Yes.
And if you are not at the webinar, even I feel something I missed. if you're not seeing your face means we are missing something.
Thank you. And so today we will have another webinar about the kalium salts. I like them very much and they are very helpful in my clinic. And I will give the introduction like last time and 2 or 3 cases from last time which are very, very informative. And we will have some new cases also. So welcome to everybody, and I will open my screen. Okay. Can you see the slides?
Yes.
Okay, so we can start. About the kalium salts, and we have kalium carbonicum and kalium, just to look at the mineral kalium, and also the kalium salts have a great importance in plants, in animals, and also in the human organism. For that, it means that they could be very important in our homeopathic remedies. And it is like this. Very prominent are the osmotic abilities. That means the exchange of fluid on the cellular level. We know we have the 2 antagonisms, we have natrium and we have kalium in every cell, and they will form the osmotic balance in our body. And there's another great field of the kalium in our body that means that is a transmission of the neural impulses with the muscular system. So that the nerve is giving the impulse to the muscle. That is transmitted also by kalium ions. So interesting enough, we will find that also in our remedies. If we have a lack of kalium in our body, material lack, missing kalium in our body, we will feel weak. That's the first symptom. And we also feel that our muscles are weak. We can have a quick heartbeat and a high kalium level. in the blood indicates kidney problems. We all know this. And now let us look for Kalium carbonicum as a homeopathic remedy. The structure of the remedy is we always will see a kind of swelling and edema because of that osmotic capacity. That swelling could be around the eyes. Normally it's at the inner part of the eyes. It can be around the eyes. It can be in the joints, in the fingers, in the feet, everywhere. Also inside in the body, in connected with the mucous membranes. We have the weakness and we have the perspiration. That is very, very important. Perspiration goes together with the kalium salts. And some very, very good keynote, which was helping me a lot, detecting kalium salts in my patients, is a time of aggravation. That is between 2 and 3 a.m., can also be 4 a.m., and it could be that the cough is worse in the morning at 2 a.m., or the asthma, respiration, or the stomach pains could be worse in that time, or the perspiration could be worse in that time. Many kalium salts are also very good remedies for female problems like menopause. And if the woman will say, oh, my flushes of feet at night and my perspiration, normally it's at 2 o'clock, at 3 o'clock, that could be an important part. They're also very typically, they're sensitive to touch. And the action of the remedy, the velocity is slow and with a continuation. That's a form of kalium energy we can see in our patients and also in the diseases in our patients. Kalium salts are not so easy to detect. They have changing and contradictory symptoms. The diseases seem hidden, but progress slowly and continuously. This was stated by Dr. James Taylor Kent in the last century, and he's right. And for me, I also found out that the kalium salts are good remedies for autoimmune diseases. As a psychological picture, we have control, perfectionism. These people like to have a structure and an order, that everything is at the right place at the right time. They will be very punctual at home. It will be very clean and tidy. And they're also fighting for the laws, so they could be lawyers or policemen. And on the other side, they have a difficulty with flexibility. They're more on the side of the order. They can be very sensitive. Outside, they seem very rational. And inside, they can be very sensitive. And that creates an ambivalence, which is very typical for the kalium salts. They have a lot of fears, fear to be alone, fear of the future, fear of death, fear of phantasma, and a strong fear of diseases and to lose control. We can understand that. And also typically, they can cry when they talk about their sickness. Let us look to the symptoms. Very strong symptom and very helpful remedy in my clinic, it is for sinusitis. The sinusitis, you also can have a swelling around the eyes, but it's also a remedy for acute infections, like also acute flu with swollen tonsils, discharge of the ear. So that is very common. but the sinusitis is more prominent. As we know, it's a very good remedy for bronchitis and asthma, especially if this will be worse at night at 2 a.m. or 3 a.m. Also, the stomach is a very prominent place of action. They can have many complaints in the stomach. That can be a gastritis, with acidity, ulcer, and they have that very special symptom saying fear arising from the stomach. It is a very great female remedy with strong bleedings and a tendency of abortion. The deliveries, the birth can be difficult because they have that lack of flexibility, and during a birth you have really to admit yourself to the process, and that can be difficult with Kalium mothers. Also, they can feel a clear weakness during lactation, sometimes with loss of hair, like acidum phospholicum. Also, they have a lot of symptoms with the back. Lumbar pain in the back, extending to the leg. They like pressure, they like a hard bed, and very special is it's difficult to turn in the bed. In the morning, at night, if they want to turn from one side to the other, that is difficult, and the remedy will be Kalium carbonicum. There are also other remedies, of course, but Kalium carbonicum has that strong in its feature. Also, the thyroid is a very important point with the Kalium salts, very important remedy, because if you have dysfunction of the thyroid gland, you also can have weakness, sweating, muscular weakness. So I have quite a lot of patients who have profiting from Kalium salts with thyroid disorders. Okay, kidney also a very big sphere of the Kalium salts, especially if it's a stitching pain in the renal region. We can have kidney stones, inflammation of the kidney, with swelling of the eyes. As we know, this is a Kalium symptoms, gives us a hint in renal diseases. Very special for Kalium salts to differentiate is normally they're very sensitive to touch, especially at the soles. So if I think about Kalium, often I ask to them, what's about your foot soles? Can you walk at the beach, or are you sensitive? And normally they say, yes, we are very sensitive. And they're cold-blooded, sensitive to cold weather. But if it's Kalium sulfuricum or Kalium iodatum, they will be more warm. Very often, because they're so sensitive inside, they cry when they talk about their sickness. They also have similarities with pulsatilla, especially Kalium sulfuricum is a chronic pulsatilla. So that sensitiveness. And one very special point, I also see it in my clinic, they have a special kind of humor. They make jokes. These jokes are, we in Germany, we say a bit white jokes. It's a bit special, but funny. And if you look at the face and at the body, often you will see big eyes, big eyes, big ears, not eyes, big ears. So sometimes I say it's a bit like Kalium salts are a bit like an elephant. They are strong outside, they are very big and very soft inside, and you have the big ears. Okay, so let us come to the patients. First patient is a woman with Hashimoto thyroiditis long time ago. And by coincidence, she was today in my office. We talked, and it's more than 15 years ago, that thyroiditis, and never anything came back. So what was pathophysiology? What is a Hashimoto disease? Most of you will know that. Hashimoto's disease, also called chronic lymphocytic thyroiditis or autoimmune thyroiditis, is an autoimmune disease. An autoimmune disease is a disorder in which the body immune system attacks the body's own cells and organs. And that's not so easy to treat. So as a clinical picture, we can have hyperthyroidism, which is the first phase of Hashimoto disease. So the patients will present them with palpitation, perspiration, loss of weight, fatigue. And in the second phase, we will have the hypothyroidism with fatigue, gain of weight, cold intolerance, loss of motivation, and loss of concentration. So this woman luckily came in the first phase. In that time, she was 55 years old, patient of mine since 8 years. And she came and she said, "Doctor, there's something very special. Since 3 or 4 weeks, I'm really feeling very weak in the age of 55. And I have a lot of palpitation, which I did not have before. And a loss of weight, 4 kilos in the last month. And my concentration is terrible." So I told her, okay, it looks that we have to control the thyroid. And they found very high antibodies and advised her to take thiamidol, which she did not like to take. She was very confident in me. "Doctor, you will treat that disease," and not knowing that this will be not so easy. So, case history. She feels very weak, has perspiration and flushes of heat, waking at night between 2 and 3 a.m., pains and swelling in her left knee, and also swelling around the eyes. If we repertorize, I have the Murphy repertory, thyroid gland, swelling face around eyes, time aggravation 3 a.m., palpitations, and swelling. First remedy is Kalium carbonicum. Second is Calcadia carbonica, which has been treated many years with Calcadia carbonica. So I decided to give Kalium carbonicum a single dose, C200. 10 days later, she's feeling better, has more energy, less perspiration, and the heart is more calm. Does not have to sleep during midday. So she has more energy, she's feeling better. Okay, 2 weeks later, I did not give any more remedy because she was better. 2 weeks later, since a few days, she has more palpitations now. So I said, okay, we repeat Kalium carbonicum C200. So that was 10 days and 2 weeks, nearly 4 weeks later. Okay, another 4 weeks later. Step by step, she has more energy. She's gaining weight, which is a good symptom. Less perspiration, but she's not 100% well. Okay, we could not expect that in such a short time. So I repeated Kalium carbonicum C200 after 4 weeks again. 6 weeks later, she felt continuously better. Blood tests are improving. She gained the 4 kilos she lost before. She can concentrate well. No restlessness anymore, and palpitations only sometimes. So I did not give another dose because she was better. So 3 months later, is really feeling well. Autoimmune bodies are down, pulse 80 and regular, never had taken thiamidol. The Hashimoto thyroiditis is cured, and I can tell you now, after 15 years, she's still well in that aspect. Conclusion: the quick and extraordinary response might be due to the good vital force of the patient, and the well-chosen homeopathic remedy. So keep in mind, the kalium salts have a great healing power. Case number 2, person with pains in the joints, edema, eczema, and menopause problem. Here we see the woman. She's a nurse, and I also know her since many years, and she also, by coincidence, came 2 weeks ago for another consultation. So in that time, she was 53 years old, a nurse, and she came primarily because she had eczema on the right hand. And that was a problem. As a nurse, it's difficult. You have to work in the hospital, you have to wash your hands, and to have an eczema there, it's not a good idea. And she also developed arthralgias with edema of the joints and has menopause problems. Okay, she's crying a lot, especially if she's talking with the doctor about her problems. She's very sensitive. And she has 2 sons. Both of them have difficulties to write and to read. And in Germany, I don't know how it is in India, but they are quite strict here with the school. And if you cannot read well and write well, you have a problem. And before the first child, she had a miscarriage in the 12th week, and afterwards 2 miscarriages in the 6th and 7th week. So tendency to miscarriage also fits into that remedy. So we see swelling under her eyes. At the moment, she's very forgetful and is complaining about a lack of concentration and motivation. Menopause is beginning, and she's perspiring a lot at night. Temperature is more to the cold. Sleep is not so easy. That is new for her. If something is new, we can take it as a strong symptom for the condition at the moment. She's waking at 3 o'clock or 4 o'clock and cannot feel asleep again. She has too much weight and feels a back pain. In the lumbar region, when she's working in the garden, she feels pain in her left knee, walking with difficulty. In the morning after rising, she feels a stiffness at her joints. Okay, what do we understand with this case? We have a hormonal remedy. We have a tendency to miscarriage. We have a beginning menopause. She is very sensitive and sleep waking 3 and 4 o'clock. So, and we have stiffness in the joints, arthralgias, swelling under eyes, perspiring at night, lack of concentration, edema, menopause. So the remedy picture could not be clearer. It is impressive how we see the materia medica in our patients. Homeopathy is a practical healing method based on observation. Here we have the repertorization, and we see Kalium carbonicum in the beginning. Second remedy, sepia. Sepia, she was in that moment, she was already patient with me since many years. In the beginning, she received sepia for her eczema in the hands here. And now we see it's also not the repertorization, but Kalium carbonicum in front. We have the menopause problem. All the picture is indicating a kalium salt. So I gave her Kalium carbonicum because she's more to the cold side, C200, a single dose. Follow up 3 weeks later. Next day, she got her menses. That was very special. Taking the remedy, and next day, she got her menses. And for the first 3 weeks, she felt very well. She did not have any swellings, and the sleep was good. So the remedy most probably affected in some way the hormonal system. Now she's perspiring a lot, and she feels a pain in her right shoulder, which is an old symptom. And the eczema at the hands is better. So we have, what shall we do now? We have old symptoms who are rising, but the patient is better. So I said here, we wait and we see. Let us wait. Follow up 3 months later, everything is fine. 2 months later, after 5 months, after the first remedy, she felt more light and not so tired. The flushes of feet are better. Her knee is much better. The skin is also very good, and now the symptoms get worse again. So I repeated Kalium carbonicum C200. In the following years, she needed Kalium carbonicum C200 from time to time, always with a very good result. Concerning the swellings, the menopause problems, and her joint pains. Conclusion: the remedy is working very deeply, and she needs it only from time to time. Okay, I know that patient already 20 years now more, and she's still doing well. Of course, a bit problems with the age, a bit problem with her knee, but from time to time taking the remedy, feeling well. So this is a case of a young woman with a very severe condition. She has a disease which is called lupus erythematosus, and she's only 31 years old and a teacher of sport in Germany. So lupus erythematosus is systemic. That means attacking inner organs, and she has arthralgia and kidney affection with hypertension. Case history: 2 years ago, she developed arthralgia and fever attacks. It started when she was working for the internship at school. This meant a lot of stress for her. She's a perfectionist and has a strong anxiety of failures. Originally, she was interested to study medicine, but her parents, both teachers, advised her to go the way of security and to become a teacher. So we see a certain conflict, inner conflict, an ambivalence. She would have liked to be a medical doctor, and now she started to become a teacher. Security was very important in her family. So because of the stress at school, she had sleeping problems and regularly woke up at 3 o'clock in the morning, brooding about her problems, and there's a clear ambivalence concerning her profession. There's a rubric which is called antagonism with self. And we have anacardium, we have ignatia, of course, but we also have Kalium carbonicum. She has pains in different joints, especially in the knees. And this is a big problem because she's teaching sports. She also has pains in her right wrist. And for that problem to write, at the moment, she's taking 10 milligrams of cortisone daily. Last summer, she has had a severe crisis with kidney problems, and she developed strong swellings in her legs, and she had to be treated in the intensive care at the hospital. Family history: father has rosacea, uncle Bechterew, grandmother cancer of liver, grandfather morbus Parkinson. So we have a multi-miasmatic situation. If we look at the repertorization and we take lupus erythematosus, we take the swellings, desire chocolate, waking at 3 a.m., and antagonism with self, that's the last rubric. We see Kalium carbonicum in the first point. That does not mean we have to give it, but it was a clear advice. And myself, I was also a bit astonished with that Kalium carbonicum. I said to myself, for that kind of disease, Kalium carbonicum, but let us see how it was working. Because she had to take strong chemical drugs. I started with LM potency, LM1 of Kalium carbonicum, 5 drops twice a day. She's taken 10 milligrams of cortisone, MTX, and antihypertensiva. As the medication could not be reduced, I did choose the LM potency, yes. Only 6 days later, very interesting results. For me also surprising. The sleep is better. If she wakes up, she goes to the toilet and she can sleep again. She doesn't think about many problems. She feels more confident. The joints are better. The stiffness in the morning is also better. So after 6 days with kalium carbonicum LM, she could reduce cortisone from 10 to 7.5 milligrams. And the urination feels better. That's also important hint. So as said, we go on with the medication, twice a day, 5 drops. 1 week later, she feels well, good energy, the joints feel more soft, the blood pressure went down, and she can also reduce antihypertensives. That's more or less 2 weeks after starting with the remedy. Go on with the same medication. 1 week later, 3 weeks after treatment, after half a year now, for the first time, she started to work again, slowly, a few hours, and she could enjoy doing this. She can move with more flexibility. Also, her physiotherapist is noticing that. And because she's a teacher of sports, that's very important that she will be able to move. So long-term follow-up. She has experience now of 1 year at school. During the years, she was improving and was able to work. She can make decisions more quickly. And to the astonishment of her specialist, the kidney kept silent and safe. So we were very, very happy with that case. And conclusion, that was a severe disease in a young age. Family history with chronic diseases. Her main problem were the kidneys and the joints. Mentally was an ambivalence concerning her profession and a strong fear of failure. Kalium salts are very strong in the treatment of autoimmune diseases, also with combination of kidney problems. The amelioration of the whole system was very quick in spite of the strong allopathic medication. LM potencies can work wonderfully in combination with allopathic drugs. So, I still have 50 minutes. Okay, I will do that case more shortly, and we have 2 more cases afterwards. This woman, case 4, in that time 53 years old, patient of mine since many years, and she has a kind of fatigue, epileptic attacks, because since birth she has a problem with her eyes and cannot focus correctly, and she sees always 2 pictures, and that makes a certain stress for the brain. And for that, if something is too much or too much computer, too much concentration, she can have a kind of fit and has to recover afterwards. She's a very friendly and sensitive patient. If she's stressed during work or emotionally, she can have epileptic-like attacks. The fatigue afterwards is mostly helped by causticum within a short time, always like a miracle, she says. And that was working well since years. 3, 5, 4, 5 times a year she can have such an attack. She's phoning me, and we give causticum, and normally next day she is better. So now she's phoning me and saying, 5 days ago I had the last attack, and she took causticum. The concentration became better, but the muscular weakness was very strong and not improving for the first time. So here we have a problem now. It was working for years with the causticum, and now I don't know why it's not working anymore. So since 5 days she's very weak. So what shall we do? We have to look for another remedy. But another remedy has to be close to causticum, because causticum always helped. And if we look what's causticum is a special remedy. It was made by Dr. Hahnemann himself. And it's a combination of calcaria, kalium, and sulfur. So I decided to look for a remedy which will be close to causticum and has a strong connection with muscular weakness. And the remedy we know, which is very special for muscular weakness, is kalium phosphoricum. So here a kalium salt, kalium phosphoricum, once a day for 3 days, 4 days later, the weakness is clearly better. I know this patient for years. And later she came into menopause with a lot of flushes of feet, strong hypertension. She had to go to the hospital one night, sleeping problems, changing moods. So concerning her temperature, she's more warm now. So I decided to give her kalium sulfuricum, which is working very well since years. So for me, kalium sulfuricum is a very, very good remedy for the menopause. I give the C200 once. And if there are waves, more perspirations, sleep is worse, more problems, I give in addition LM potency of the same remedy every day. And so we can manage quite well. So we say in Germany, the apple falls close to an apple tree. So if a remedy was working very well and it's not working again anymore, look for a very close remedy for this condition. Okay, next case, it's a little boy which is now grown up. I know this boy since he was 4 months old. Diagnosis is eczema in chronic bronchitis. He was born 8 weeks too early and was very small, 1 kilo and 800 grams. So as we know, if the babies are born too early, very often they have problems with respiration, with the bronchus. Before of this pregnancy, his mother had 3 miscarriages. So it could be that the mother also is a kalium patient. Okay, now let's talk. He's 5 years old with that picture, with that photo. Chronic recurrent pulmonary infections, a lot of cough at night. The mother cannot bear it anymore. Often waking at 2 a.m., perspiration at night. Obstinate. What he wants, he wants. Was treated well with polynosis, with sulfur, and also with tuberculinum. Never needed an antibiotic in all these 5 years. So sometimes we cannot avoid that they get sick again and get symptoms, but we can avoid to give antibiotics. But now these remedies are not working anymore. He has a time aberration at 2 a.m. His perspiration, sulfur was helping before, so I decided to give a kalium salt, and because sulfur was helping before, I decided to give him kalium sulfuricum, LM1, 7 drops, 3 times a day. 2 weeks later, the cough is much better. We can reduce once a day, 7 drops, and the long-term follow-up, 10 years later. In the following years, he received for his allergies and cough mainly kalium sulfuricum, LM, with good success, and sometimes tuberculinum in C30 or C200. Here we see the picture. He's always joking. Here's a picture, Dr. Eileen. This is a little boy. He's always making jokes. Now he's much stronger. And last consultation was in March. He's now 15 years old. Polynosis with constant obstruction of the nose, cannot sleep very well because of this. Kalium sulfuricum LM6, 7 drops twice a day. Conclusion, it seems that the kalium salts have a tendency of long-lasting effects, being helpful for years. This is an observation in my clinic of 30 years now. So let us go to the last case. This is a woman, I know her since 1 year, with many, many problems. Only 42 years old. She had adipositas per magna. That means she had more than 120 kilos. And for this, she had been operated at the stomach, losing a lot of weight. But because of that losing weight, she also did lose the fat inside the abdomen. And the fat, which is helping the kidneys to stay at their position, was also being reduced. And that gave a big problem. She also had Hashimoto thyroiditis, kidney stones, pyelonephritis, and cystitis. A year ago, she was operated at the stomach, losing all these kilos. Weight at the moment 82.5. In 2010, she had her first kidney stone, and in 21 again, kidney stones which were destroyed by ultrasound. She had been taking a lot of vitamin D. Perhaps this was causative for the problems of the kidney stones. 1 year later, after the destruction by ultrasound of the kidney stone, she had cicatrices in the urethra, which called a pyelonephritis. High fever, oliguria. She was hospitalized, got antibiotics, and a plastic tube between kidney and urethra. That was the operation. And now she came to me and she said, the plastic tube is really painful. If I go to urinate, I feel it strongly. And I said, but that's a mechanical problem. What can I do with homeopathy? But I said, the only idea I could have is to give Staphysaria. So I gave her Staphysaria for that problem. And 3 days later, she said, 1 hour after taking Staphysaria 200, it was much better. So she felt less that plastic tube inside her body. That was also impressive. And okay, remedy. We have kidney stones, we have weakness, swelling, Hashimoto. She's also a really jesting person, making jokes, that kind of humor. So I give her 10 drops, Kalium carbonicum LM1, and I also give her thiocinaminum C30 once a month because she has that strictures in her urethra which can cause problems with bacteria, with pyelonephritis. So to summarize, 7 months later, the right kidney is okay, left kidney 18%, which is not a problem. No cicatrices anymore in the urethra. 3 weeks ago, a corona infection. Now she feels very weak. She got arsenicum album, C30 twice a day. The infection gets better, 50%, still weak. So I said, no, we go on with the constitutional remedy, Kalium carbonicum, LM3, 10 drops daily. So 5 weeks later, weakness and tiredness are getting a bit better. Still has to sleep in the afternoon, but she also started to work part-time. And now she feels pain in the joints of her fingers, which is a kalium symptom. So I said, okay, we go to LM3, 10 drops daily. 5 weeks later, weakness and tiredness getting a bit better, still has to sleep in the afternoon, but she also started to work part-time again, so we can understand it's taking more energy of her. Now she feels pain in the joints of her fingers, which is a kalium symptom. And because it was 5 weeks and she did not contact me and taking the kalium 5 weeks every day, which is a lot, I said, okay, if it's getting worse at the moment, please, we have to reduce, we have to the remedy. And I said, let's take it now every second day. Okay. 4 weeks later, she feels better. But now, after taking the remedy every second day, she feels tired for some hours. So she takes the remedy and she nearly is going to sleep. That's also not a good idea. So I said, perhaps you're getting more sensitive. We have to reduce. And I decided to give it every second day, but in the second cup. And that was a good solution. So 3 weeks later, she says, I'm much, much better. The kidneys are good. The creatine is normal, which is a very, very good sign for her. Bladder is good, no pains, and she's able to work. Okay. How shall we proceed, Dr. Ailini? Would have a little case of 3-4 minutes, or shall we have some discussions?
We will have discussion. That will be nice. I think only 5 minutes more. No, 15 minutes we have. 15
Yes.
minutes. So you can proceed with one more case.
Okay, thank you. That's a case of multiple basalioma in the face. Case history. It's an old woman, 89 years old. Symptoms of muscular weakness, easy perspiration, vertigo, multiple basaloma in the face. History of different basaliomas before, which had been operated. Now she developed a new basaloma on the nose and refuses a further operation. Here we have the picture of the basaloma. Because of the general symptoms, here's a picture of the basaloma. Because of the general symptoms, we had an indication for kalium carbonicum. If we see skin cancer epithelioma in the repertory, we see different kalium salts. So I choose to give her for the general state, weakness of the muscles, perspiration. I choose kalium carbonicum for her, 10 drops every day. Okay, 2 weeks later, she's feeling a bit stronger, less vertigo, which is important for that age. And she's content and she's asking again for a homeopathic treatment of the basaloma. She does not want to operate again, and it's on the tip of the nose, which is not a good localization. So I said, I don't know what we can do. First, we treat your general state, and we did go on with kalium carbonicum, LM1, 10 drops once a day. Wait and see. 2 weeks later, she's feeling more energy, less weakness of the muscles, less vertigo, and the surprise. Let's look at the nose. The basaloma is gone. Here we have the picture of the side, here and here. The basaloma seems to disappear. So we did go on with kalium carbonicum, 10 drops daily. 2 weeks later, at 6 weeks after the beginning of the treatment, the patient feels better. Basaloma is gone. So we have a happy patient. Homeopathy is an art of healing. It works and it cures. Thank you for your attention.
Thank you, Dr. Beatrix. It was actually many cases with a single remedy, like in our Malayalam we say Ottamuli. Dr. Manoj, what is the English for Ottamuli?
I don't know, but maybe
there is a, I don't know the English of that. Actually, you are showing different cases with the Kali
Yes.
group. That is nice to remember us.
That was the idea of me. Yes, yes.
So it was nice, and you treated autoimmune diseases, basal cell carcinoma, like many incurable
Yeah,
with other system. So you have shown the courage to take all those cases with homeopathic medicine. Excellent. And I think everyone will have questions. Participants, please raise your hand and ask questions. Dr. Manoj, you are the starter.
Yes, somebody should do that.
Yeah.
Okay, as always, wonderful presentation. And the Ottamuli is the single ingredient, is the version given by Google. Single ingredient is Ottamuli. Anyway, it's a nice presentation, and moreover, it's a monumental work by Dr. Samuel Hanipa in preparing this causticum, the medicine. That's an important thing. Then again, you presented a couple of cases, very wonderful cases, the autoimmune conditions, the thyroiditis, almost all are really causing headaches to the patient as well as the physician. Then again, once again, remembering us about the individualization, the art of individualization, artistic, scientific, and logical combination of factors having coherency and individuality, as said by Stuart Close. We are happy to see that a person from Germany, after 225 years, doing the same thing. And the patience you apply, you have the knowledge, the wisdom, patience, and courage. A wonderful presentation. Thank you, and come again. Not only the presentation, but also regularly participate, and you can make your own comments. I think it's around 5 o'clock in the evening in Germany. Okay. Thank you.
That's what I'm telling. If we are not seeing Beatrix, Dr. Beatrix face, means we are missing something.
Yes, definitely.
Thank you.
Okay. Dr. Kalyan, you have question? Okay, you can ask now.
Can I audible?
Yes, yes, yes,
Can
sir.
I audible?
Yes, yes.
Yes, sir. The speech of the madam is very nice, Telecart, but few points I want to mention this. One thing is, every Telecart patient is inclined to the obesity patient, just like the Calicardiac or the graphitis. Second thing, Calicar patient have short neck patient, just opposite to the nitromure. Nitromure patient had long neck and Calicar have short neck. So this is the peculiarity of the nitrum group and the Cali group. Next point is
Sorry, just a second, please. I cannot understand very well because the sound is very low. Dr. Ayani, could you repeat his question, not to forget?
Calicar patient short neck. Neck means gardan. Yeah, this short neck.
Ah, the neck is short. Yeah.
Short neck.
Yeah. And Natrium muriaticum has a long neck. That's true.
This is the peculiarity
And,
of the Calicar.
yes. And did you also see that they have big eyes? Big eyes?
Big eyes.
Ears, big ears, like an elephant.
Only I am telling you
Yes.
about the neck region. Second thing is, Calicar is a chili patient.
Yeah, of course. But if they get warm, you can switch to kalium sulfuricum, which is very interesting.
Calicar is a chili patient, but some symptoms aggravate in the hot weather.
I did not understand this now.
And third thing I am telling to you, in the female case, patient feels badly weak before the appearing of the menstruation.
Yes, can be irritable. Yes, that's true.
So this is the fourth point I mentioned with you.
Thank
Okay,
you.
thank you, Dr. Kalyan Saru. Now I think Mariam Salcedo.
Thanks, ma'am. Good morning, good evening, good night, wherever you are. Thanks for this little question for Dr. Beatriz. Thank you, Beatriz. It was a nice explanation about Kali group. It's very difficult to arrive to some Kali patient. So what could be your advices or your keynotes to keep in mind of Kali group? What you can recommend us to keep in mind to remember a Kali group?
The keynotes.
Yeah.
So very, very important is that aggravation at night, 2 o'clock, 3 o'clock, 4 o'clock. I was taking a lot of patients like this. Then we have that kind of swelling, that it's not a small body normally. It's more a strong body, and we have the swellings combined with the perspiration, and the pains are stitching. That's the 4 points which are very, very important. But the swelling and the edema is very prominent also. And in the personal way, these people seem to be very structured and mentally very intelligent, structured, but inside they are very soft. So here we have very important, we have that form of ambivalence. And we can see it in the repertory. That helped me a lot to detect these remedies. I prescribe them every week, Mariam. I prescribe them every week. And thank you for coming again. For you, it's a repetition, but you see more details, seeing things twice time. Huh? That's true.
Yes, thanks, Beatriz. It's not too common in America, so I will read again and again and again. And thanks for give us this keynote to remember Kali group. Thank you.
Yes, very good. Thank you, Marianne.
Ganesh has raised hand. Before that, I want to say Dr. Beatrix is maintaining relationship with the patient with long years. That is the best Normally, if after curing, we will not have any contact with the patient. If they're cured or not cured, even we we are not maintaining such a relationship. That is appreciable and love you for
Ah,
that.
that's nice. Yes, because I'm the family doctor of these people. And if they
Oh, okay.
trust me, they come back. If they have any problems, they trust me, they come back. So we have that kind here
Oh,
in Germany. We
you are the
yes.
family doctor of that.
Yeah, yeah.
Okay. Okay then. Okay. Dr. Danesh?
Yes, Dr. Beatrice, it's really a very good session once again from you. All the three cases were extremely brilliant. And I must say that the most important point, of course, some doctors added something more to this, your presentation. All Kalis are workaholic, and particularly Kali Kar always enjoy the beauty of work and always doing work for others also in the family. She never take rest. And that's the reason why her back is getting more and more problem, and that's the reason why she has to depend others for that, all these things. And in the other case also, the boy's case, that also show you saw the comics on the boy. That's the reason
Yeah.
why you chose that remedy. Of course, the time is one of the important thing aspect as far as your presentation, but most of the Kalis have the same time aggravation, and the exception, with the exception of kali iodide, all the kalis are chilies, and the kali iodide is a hot patient. And as you know that that's the why the kali iodide patient is slimmer than what kali carb and all other kali groups. And always when we choose the right remedy, definitely it works, and you're sticking on that remedy, and that's the reason why you got such a wonderful result in the second case where the tumor was removed from the mouth, that was removed from the nostril. Anyway, congratulations, and we hope some of your skin or cases in the coming edition of your presentation. Thank you.
Thank you, Dr.
Okay.
Danish. Thank you very much. Always a
Thank you,
pleasure.
Dr. Danish. Now we are going to Dr. Ram Parvesh Shah. After that, we will move to Malayalam session. So you can also talk, sir, please.
Thank you, Dr. Anjani, and congratulations, Dr. BEATRIX. Very nice. Many presentation case. Kali group. Kali group is a very good remedy. Vitality, a strong remedy. Kali group.
That's true. Yeah. Yeah.
Background of tuberculosis diathesis and gouty diathesis symptom is a very good treatment of Kali group. Kali group is the chilli remedy, but carbo-veg is a complementary remedy. Kali group. Thank you. Very, very thanks, Dr. BEATRIX.
Thank you, Dr. Ram Parvesh Shah. Dr. Amir Malik has raised hand. Doctor, you have 1.5 minutes.
Greetings. Greetings, namaskaram to honorable doctors. God bless you, all of you. Happy to see you, all of our doctors and members of IFPH. Honorable Dr. BEATRIX, you have done a great job. You know, you belong to the revelation. The revelation in the health department is by our father of homeopathic medicines, Dr. Frederick Samuel Hahnemann, who gives the revelation in the health. And you are the pioneers, you are the legends. So we appreciate whatever you have, give the presentation, we'll follow you. And the second biggest country in the world is the mother of homeopathic, India. Love it. Have done a great job for the humanity. Then London, then USA, everyone. So a lot of thanks and appreciation. The way you have chosen is a classical way of homeopathic. It's a very rare, very good, and the best way as our father prescribed. So very good presentation. Thankful to you. Come all.
Thank you, Dr. Amir Malik. Thank you so much. So today we all are very happy because a gem from Germany joined with us, and we are moving to Malayalam session. Now it is time for the Malayalam session. Thank you, everyone. Bye bye. Good night.
Thank you.
And I'm welcoming Dr. P. Shaila for moderating Malayalam session. Please.